Hello, everyone, and welcome to today's ADA webinar, Best Practice CBT for Tinnitus Distress. I would like to introduce today's presenter, Dr. Bruce Hubbard. Dr. Hubbard is a visiting scholar at Columbia University Teachers College and a past president of the New York City Cognitive Behavior Therapy Association. On developing tinnitus distress in 2005, Dr. Hubbard, an experienced clinical psychologist, turned for help to the only evidence-based treatment, which is CBT, but could not find a qualified expert. After successfully guiding himself through the program, he went on to found CBT for Tinnitus, LLC. Dr. Hubbard, thanks so much for joining us today.
Welcome, everyone.
Yep.
Welcome, everyone. I am thrilled to be here. Sasha, thank you for inviting me back to talk about cognitive behavior therapy for tinnitus. Our first webinar that we created together has helped a tremendous amount of people. I've gotten great feedback on that. It's had over 325,000 views to date. So I'm honored to be invited back to expand on some of the important themes. Just a little background about me, about how I got here, because I serve a unique role in the tinnitus community. As Sasha said, I'm a board certified cognitive behavioral psychologist, and I have tinnitus. My tinnitus started suddenly in 2005. Since then, I've coached and treated over 1,500 people with tinnitus worldwide. In this talk, I'll share my personal experience as well as my professional expertise. And I'll use this opportunity to address some of the most common questions that have come up from the first webinar. So I'm going to talk about more detail about tinnitus characteristics. I'm going to cover more detail about tinnitus habituation. And I'm going to close with my recommendations for a best practice version of CBT for tinnitus. So what is tinnitus? Tinnitus is a common neurological condition. It's internal sound, not produced by sound waves. It's sound that's produced entirely by the brain. Tinnitus is heard as any other external sound, but located somewhere in the ears or head. And its most likely cause is nerve damage in the inner ear, or the cochlea. It's also significant to know, and I'm sorry to have to say this to people, that there is to date no effective treatment for tinnitus for the sounds that we hear. Once the sounds start, they're typically present for life. As someone who suffered with tinnitus, I know how hard it is to hear this. But fortunately, as we'll see, there are strategies that we can use to make it a lot easier to have tinnitus. As we'll see, there's a lot we don't know about tinnitus, but we do know how to pronounce it. It is pronounced tinnitus with the emphasis on the first syllable, the tin. Tinnitus is in the common lexicon. Many people pronounce it tinnitus. That's okay too. You'll see me slip back and forth. So how common is tinnitus? Well, if you look on the internet or just through media articles about tinnitus, it seems like a rare affliction. But in fact, tinnitus is really common, especially as we get older. Just about everyone has some form of tinnitus. Subthreshold tinnitus is tinnitus. I think about 95% of people who don't have persistent tinnitus have subthreshold tinnitus, where, if they go into a really quiet room or a soundproof booth and they turn their attention to what they're hearing, most of those folks will hear tinnitus. And everyone experiences temporary tinnitus at times, like the ringing in your ears after a concert that's typically gone by the next day. So what we're really asking here is how many people have what's called persistent tinnitus? Well, it's about 10 to 15% of people worldwide, and that's about 1 billion people. But it's important to understand that while tinnitus can start at any age, it becomes much more common as we get older. You can see that under age 40, the chance of tinnitus starting is very low, about 5%. By the time you're in your 40s, the incidence of tinnitus starts to pick up. There's an 18% chance, about 1 in 6, of tinnitus starting in your 40s. I was 45 when my tinnitus started. In your 50s, the chance of tinnitus starting is 1 in 4. And in your 60s, it's a whopping 33% or 1 in 3. We can see that in most cases, tinnitus is a common problem of aging. So what's tinnitus like? I get a lot of questions from people explaining my tinnitus is like this. It's this loud, it's this high frequency, I'm hearing this sound, it comes up in this pattern, and they're concerned that there's something unusual and different and are frightened about that. But probably the greatest concern that people with tinnitus distress have is that their tinnitus is too loud to ever habituate. People often describe their tinnitus as a screech, a jet engine, a siren, a jackhammer. And if you don't have tinnitus and you hear these descriptions, you must think this is really awful. Now, those are some of the loudest sounds we hear. And it's hard to imagine how someone could live with those sounds in their heads. But how do you estimate a subjective experience like tinnitus volume that no one else can hear? Well, one way is to just ask people to rate their tinnitus on a 1 to 10 scale. And it's assumed then that these ratings, if someone, selects a 1, 2, or 3, their tinnitus must be really low volume. Or if they select an 8, 9, or 10, it's got to be really loud, like in that, police siren range. Well, not surprisingly, studies show that these subjective ratings are highly biased by how distressed we are by our tinnitus. Higher distress, louder our tinnitus seems. As distress comes down, so does our experience of tinnitus volume. So we need a more objective method of measuring each person's tinnitus volume. The loudness match is our best bet. Loudness match uses an external sound, a sound that can be objectively measured in decibels, and one that everyone can hear as an objective standard to compare to your tinnitus. Typically, the tester hands you the controls and you just adjust the volume of an external sound until you estimate it matches the volume of your tinnitus. When you're done, the decibel level of the external sound is taken as an estimate of your tinnitus volume. My thanks goes out to the Oregon Health and Science University and the people running the tinnitus program out there who have over many years collected data, trying to be as objective as possible. And they have published this data through a website called tinnitusarchive.org. And this is readily available to any of us to go and look at their results. I'm going to be drawing heavily from their database in describing tinnitus characteristics. So using the loudness match method, how loud is tinnitus? Well, first, let's get acquainted with a typical decibel chart. So I'm saying decibels. Decibels is the scientific unit of sound loudness or volume. And this chart indicates the loudness of different sounds that we're familiar with. To get some perspective, hearing threshold is just above 0. You can see the threshold of pain. If a sound is so loud, it can actually do physical damage, is 130 decibels. And I've included heavy traffic right there in the middle. 80 decibels, roughly the sound of heavy traffic is about the level where sound begins to be experienced as loud. You can see that these are some of the loudest sounds that we'll encounter: a shotgun, jet engine, police siren, jackhammer, whistle, a shouted conversation. And you can see that these are some of the more moderate volume sounds: washing machine, normal conversation like we're doing right now, moderate rainfall, a refrigerator. And these are some of the quietest sounds that we encounter. A close whisper is a foot from your ear. Distant whisper is 5 feet from your ear. Quiet study room, gentle breathing, and just about the quietest sound we can detect, a sheet of paper landing on a floor. Now here's the volume of tinnitus. 98% of tinnitus using the loudness match method comes out to be under 20 decibels. So that's, again, among the most quietest external sounds that we're exposed to: quiet study room, gentle breathing, falling paper. 2% of tinnitus, that's about 1 in 50 people with tinnitus, then will have tinnitus above 20 decibels. So now we're getting into the range of a distant whisper, a close whisper, a refrigerator, a moderate rainfall. So we can be grateful that, as awful as tinnitus seems, it's never really as loud as a jet engine, a siren, a jackhammer. It's never so loud that it drowns out speech. Another concern people have is that their tinnitus is super high frequency, that it's too high to ever get used to. Well, how high is tinnitus? So tinnitus pitch or frequency can be estimated objectively through what's called a pitch match, which is a similar technique that I described for a loudness match, but this is varying the frequency or pitch of the external sound until you feel it matches your tinnitus. So again, I'm going to orient you to the frequency chart. This is the full range of human hearing. We actually have a tremendous range of frequencies we can detect, all the way from about 250 up to 20,000 hertz. This is the range of speech. You can see this is at the very low end of the frequency range, from about 250 to 5,000 hertz. These are some of the lowest frequency sounds we can hear: heavy rainfall, ocean waves. And these are some of the highest frequency sounds that we encounter in nature, songbirds and crickets. So let's look now and see that this is the range that audiologists consider to be high frequency hearing, from about 2,000 all the way up to 20,000. And here's the range of tinnitus. So you can see that most tinnitus falls into this high frequency range, which just corresponds to people's descriptions of their tinnitus as super high frequency. And you can see now, it's interesting because, as we saw, tinnitus tends to be really low volume. But why is it so noticeable then? Why can it be so intrusive? Because it's so high frequency that it tends to cut through most commonly encountered sounds. That makes tinnitus hard to mask and makes it seem a lot louder than it is. People also get concerned with the pattern of their tinnitus. By pattern, I mean how a person's tinnitus characteristics may fluctuate over time. At least 70% of people with tinnitus report fluctuations in volume. These fluctuations can occur over days, weeks, or months. I commonly meet with people whose tinnitus seems to fluctuate by days, so that when they may wake up in the morning, they never really know what they're going to get. It is important to understand that these fluctuations occur within a particular range, so it's not completely unpredictable. You may have quiet days and louder days, for example. So what people call spikes, in my opinion, are just normal fluctuations in the volume of your tinnitus, not something that can be, not something that should not be occurring, and not something that can in any way be prevented. And about 40% of people describe their tinnitus as reactive to external sounds. By that, I mean when they're exposed to particular external sounds, they experience temporary increase in the volume or a change in the quality of the sound in some way. Typically, once they're removed from that sound source, their tinnitus goes back down to baseline within may happen instantly, or a few minutes, or a few hours, or by the next day. And what's the quality or type of each distinct sound that people hear? Well, here's a chart that describes a number of sounds that people commonly report. Most of the common sounds are ring, hiss, and tone. Together, these account for over 90% of tinnitus, but you can see there are all kinds of options for what people can hear. And it's common, 50% of us, me included, have more than one tinnitus sound, either simultaneously or alternating. And it's not just tinnitus. There are several commonly related conditions that occur along with tinnitus. We generally notice these around the same time tinnitus starts. And these can be very scary and make the initial adjustment to tinnitus even harder. Hyperacusis occurs for about 30 to 40% of people with tinnitus. This is pronounced hyperacusis, like the word acoustic. Hyperacusis is a condition in which common safe sounds are heard as uncomfortably loud. It can be comforting to know that hyperacusis generally does fade over the first 6 to 12 months from tinnitus onset. High frequency hearing loss is another common problem of aging, and you lose your crisp highs from your experience of sound. Sounds can become dull, muffled, and you may have trouble hearing speech against loud backgrounds. About 85% of people with high frequency hearing loss also have tinnitus. Phonophobia is an exaggerated fear and avoidance of safe levels of sound. Phonophobia is a common associate of tinnitus distress. This is not something that's commonly related to tinnitus itself, but to tinnitus distress. And what people are avoiding is sounds they believe are going to make their tinnitus worse, or if they have hyperacusis, are going to be uncomfortable to experience. So we can see that there's often a lot going on for people with tinnitus. Tinnitus experts commonly, if you have more than one feature of the problem, refer to it as complex tinnitus, but I'm not so into referring to people's conditions as complex, or my condition as complex. So I just describe it as it is, tinnitus and related conditions, or you'll hear me commonly just say tinnitus RC. And when I say tinnitus RC, it means I'm referring to that other stuff that may be going on for you. If you just have a simple tone, that's fine as well. So my tinnitus is a great example. In terms of internal sound, I have on the right side rather, a high-pitched tone. I have higher pitched overtones that are coming and going. I have a high frequency wisp. On the left, I have a lower volume, high frequency tone. So I have 4 tinnitus sounds altogether. On the decibel chart, and I had my tinnitus volume estimated by a qualified audiologist, my tinnitus is about the level of gentle breathing, which is around the 75th percentile. So it's on the loud side for tinnitus. And my frequency is right around 10,000 hertz, which is about the most common frequency reported for tinnitus. And it's super high, guys. Again, you can see the crickets and songbirds, nature's high frequency producers, are around 5,000 to 6,000 hertz, and most people's tinnitus is at around 10,000. In addition to the sounds, I do have hyperacusis on the right side, and it was severe when it first started and very frightening for me. It has faded over the first year or so. It faded to probably about 10 or 20% of what it was initially. I still have it, but it's not an issue. And I have high frequency hearing loss on both sides. And it's been like this 24/7 for 18 years. So how distressing is tinnitus? Well, again, if you look at the internet or media reports, you get the sense that to have tinnitus is to suffer. But when you get away from these sources and look at large-scale random surveys of people in the general population with tinnitus, despite how awful tinnitus can be, we see a much more hopeful picture. Fortunately, most people with tinnitus aren't distressed at all, or are just mildly distressed. And how distressed you are seems, and this is counterintuitive, to have little or nothing to do with the volume, pattern, pitch, or type of sound you're hearing. Of the general population of people with persistent tinnitus, 50% report having no problem at all. 25% report it as a minor problem. About 20% report it's a moderate problem, and 5% experience their tinnitus as severe. So that's about 25% of people who have a significant emotional reaction to their tinnitus. 250 million people worldwide. Tinnitus distress is an emotional condition consisting of emotional distress, hypervigilance or excessive exaggerated attention and monitoring of tinnitus sounds and sensations, persistent worry, rumination, hopelessness about your tinnitus, avoidance and withdrawal, and impaired functioning, which almost inevitably affects sleep, concentration, and leisure, just the ability to just let go and relax. Tinnitus distress severity can range from mild, where you're annoyed and distracted, to moderate, where you're moderately distressed and your functioning is moderately affected, to severe, where you're completely hijacked by tinnitus. What causes tinnitus distress? Well, we've seen that tinnitus can be awful. Maybe the people who are more distressed have more severe tinnitus. And by that, I mean louder, higher, more erratic tinnitus. Well, several studies have addressed this question. I'm going to highlight two of these. Candace Manning and colleagues performed loudness matches on 160 men and women with persistent tinnitus. They then compared these to a carefully derived measure of tinnitus distress. And they concluded tinnitus volume and pitch are unrelated to tinnitus distress. There were people with very loud, erratic tinnitus who had no distress at all, and people with very low, simple tinnitus who were beside themselves with anxiety. Meikle, Vernon, and Johnson gathered loudness match, pitch, pattern, and type of sound for 180 people, 1,800 people with tinnitus. These are the same folks, by the way, who created the Tinnitus Archive, so they're drawing from that database. Again, contrary to expectation, they found tinnitus volume, pattern, pitch, and type of sound are unrelated to tinnitus distress. So how distressed we become has little or nothing to do with the tinnitus volume, pattern, pitch, and sound type. Louder, higher, more variable tinnitus does not inevitably lead to greater distress. So how distressed people are may have little or nothing to do with their tinnitus characteristics. People who aren't distressed likely have tinnitus that's similar or even identical to those who are. So someone in the severe category may have the same tinnitus as someone in the no problem category. How is this possible? How can someone have the same tinnitus as you and rarely notice it and not care when they do? These people aren't distressed because their brains have undergone a natural adaptive process called habituation. Through habituation, the brain automatically reduces its attention to an emotional reaction to tinnitus. Through habituation, it just gets easier to have tinnitus, less of a burden. You don't think about it as much, and when you do, you don't care as much. At the highest level of habituation, what I call full habituation, you rarely notice your tinnitus at all. And when you do, it's emotionally neutral, like the sound of a fan. Most people describe this state as the equivalent of a cure. I believe habituation is responsible for the greatest reduction in tinnitus suffering worldwide. When your doctor says you'll get used to it, learn to ignore it, learn to live with it, what your doctor means is you'll habituate. So what is habituation? The brain is exposed to so much stimulation every given second of the day that it must have a filter that automatically sorts incoming sound and other sensations into what's important and deserves close attention and what's not important and can be safely turned down or screened out. Habituation is not something special to tinnitus. It occurs in all 5 seconds. There are numerous examples from our everyday lives. the pressure of our bodies against surfaces. Just pause for a moment and become aware of your body against your seat, your arms on a desk or the arms of a chair. There's a lot of sensation there, I guarantee you. And you weren't aware of it until I pointed it out, and I promise you'll forget about it again in seconds. The frames of your glasses, the scent of perfume, natural sounds, artificial sounds, louder settings. Even some of the loudest sounds we're exposed to, loud random sounds like passing trains and air traffic, can eventually fall to habituation. When I first moved to New York City, I lived on the same block as the local police station, and I had a second floor studio apartment facing the street. So at random times through the day and night, sirens went by right underneath my window. And at first I thought I'd made a big mistake by moving there, but by the end of the first year, I barely noticed those sirens. And I lived in that apartment for 5 years. It was a great place to live. So when I was in the throes of my tinnitus distress, I remembered that, and I was hopeful that if I could habituate to police sirens, I could eventually habituate to the siren in my head. I introduced tinnitus habituation in my first webinar. Here I'm going to describe more detail about this important solution for tinnitus distress. The tinnitus habituation model was originally proposed by psychologist Richard Hallam in 1984. As a new sound, it's normal for the brain to increase its reaction when tinnitus and other sensations first occur. But because tinnitus is ultimately not important, and by that I mean not dangerous or painful, the brain's natural tendency is to gradually weave tinnitus into the background through habituation. Habituation is the desired outcome of neuroplasticity, how over time the brain changes how it automatically processes tinnitus. At first, tinnitus is categorized as an important threat, a threat to safety and comfort. Over time, tinnitus is gradually recategorized by the brain as unimportant, a false alarm, a paper tiger. Habituation sounds like a great solution to tinnitus. So why do some people habituate on their own automatically while others suffer? What makes the difference? Why haven't I already habituated? I get this question all the time from my patients and clients. Well, first of all, it's likely you're already in process of habituating to your tinnitus. Habituation is very gradual. It can take a long time. As I say, by the time people come to me for help, they've already begun to habituate to their tinnitus. If there are times your tinnitus bothers you less than others, that's habituation. If there are moments or longer stretches of time when you aren't aware of your tinnitus, you just forget about it entirely, that's habituation. What we need to be alert for are the psychological factors that make us vulnerable to tinnitus distress. These are the same factors that cause tinnitus distress in the first place. They also block habituation. For example, placing a high value on maintaining control over sound and silence, having a tendency toward worst-case scenario thinking, having a tendency toward anxiety and depression, having high levels of general life stress. So it's important to understand that the same factors that promote tinnitus distress can also block habituation. Taken together, these factors lead to what I call tinnitus resistance. Tinnitus resistance is a state of fighting, avoiding, problem solving, attempting to control your tinnitus RC, to reduce the volume, to make it go away. While natural and understandable, even heroic, going to the mat resisting tinnitus carries an unintended consequence. It blocks habituation. Through tinnitus resistance, you risk falling into what I call the tinnitus trap, and I introduced this in our first webinar. The tinnitus trap is a vicious cycle where your negative response to tinnitus drives and sustains your brain's automatic negative reaction. In my opinion, it's not tinnitus, but the tinnitus trap that causes the greatest degree of tinnitus suffering worldwide. I became well acquainted with the tinnitus trap over my first 6 months with tinnitus. At first, I kept hoping there'd be a simple fix, like removing earwax or clearing my sinuses. But when the doctors kept telling me there's no treatment for my tinnitus, my emotional reaction went up and stayed up. I was desperate to bring the volume down, to eliminate spikes. I did everything I could, including dietary changes, supplements, and constant internet searches, but nothing worked. I was fortunate that as a psychologist, I eventually understood that if I couldn't control my tinnitus, I would need to commit to the courageous work of accepting it. Acceptance reduces the importance we place on tinnitus and frees up our attention and effort to adapt to tinnitus and to engage in the courageous work of fully re-entering life. The wisdom of acceptance is age-old and applies to all unwanted, uncontrollable realities we face, like chronic pain, illness, unwanted life circumstances, loss of a loved one. How do you accept something like tinnitus that you resist with every fiber of your being? This is a great question. And the answer is that for that 25% of people who have significant tinnitus distress, adapting and habituating to tinnitus is going to involve much more than a simple perceptual adjustment. You're not going to benefit from just putting on some background sound and trying to ignore it. For many of us, recovery from tinnitus distress involves an emotional adjustment to tinnitus. We've got to work through the fear, the anxiety, the hopelessness, the despair. For many of us, tinnitus can trigger a wide range of emotions. Irritability over being so distracted and derailed by tinnitus, sadness on grieving the loss of your prior quality of hearing, the loss of silence, anger toward others who you believe may have caused your tinnitus, guilt if you believe your own careless actions may have caused your tinnitus, and shame that you, unlike others, can't just shrug tinnitus off. This emotional adjustment to tinnitus complicates the perceptual adjustment. It requires a different set of tools. This additional challenge can add significantly to the process of tinnitus habituation. Over my first 6 months in the tinnitus trap, I developed a lot of bad habits I had to then overcome. But once I committed to acceptance, I very gradually, my attention to tinnitus and my emotional reaction to tinnitus went down. I gradually re-engaged with all the lost areas of my life and eventually achieved full recovery, full habituation. You can see the timeline if you look down at the horizontal axis. It easily took me 24 months to achieve full tinnitus habituation. But you can also see that it gets a lot easier along the way. It's so even a little bit of habituation can have a big positive impact on your well-being and functionality. Here's another question I get a lot. Can everyone fully habituate to tinnitus? And how do I know I can make it all the way? Well, it's certainly the goal of my CBT for tinnitus program to get everyone the tools they need to fully habituate to their tinnitus. But the truth is there are many factors that affect the course of habituation. In the original webinar, I cited a 98% probability. This was a popular statistic at the time, but it's probably not realistic because, again, there are so many factors that come into play. These factors need to be addressed in a good CBT program. But the more important question is, what can I do to get habituation started? And if I've already begun to habituate, what can I do to get to the next level? So this brings us now to my recommendations for a best practice cognitive behavior therapy for tinnitus distress. And we don't know how to treat tinnitus, but we do know how to treat tinnitus distress. So if habituation is the star of the tinnitus show, cognitive behavior therapy is the co-star. Cognitive behavior therapy is the only evidence-based treatment for tinnitus. Over a dozen high-quality studies show that it helps significantly. CBT is the only treatment recommended in both US and European tinnitus clinical guidelines. Sound therapy, supplements, dietary changes, bimodal stimulation are not recommended. So based on the research, there's no question that CBT is the best option for people struggling with tinnitus. So it's very important that CBT be made available for these people with tinnitus distress. Unfortunately, there's a problem getting quality cognitive behavior therapy to the people who need it. In my field, this is called an evidence to practice gap, where we have the techniques to help, but we don't have the clinicians available to provide them where they're needed. And in the case of tinnitus, it's an evidence to practice chasm. We really need more qualified cognitive behavior therapists, mental health professionals to get involved and to help. Right now, there's just a very small handful of us throughout the world. So this has created a void where non-mental health professionals are scrambling to meet the demand. And as a result, there's much misunderstanding about what CBT is. And many programs that claim to be providing CBT for tinnitus are in fact based on outdated versions of CBT or include only one or two of the key components. So I'm going to review now what is CBT and who's qualified to provide CBT. Well, most people think of CBT as changing your thinking about the problem to change how you feel and behave. They expect that the primary focus of therapy will be to change how you think about tinnitus. You'll be tracking your negative thoughts and replacing them with positive thoughts. Well, this could not be further from the truth. Many people make this mistake of oversimplifying cognitive behavior therapy in this way. But obsessively tracking negative thoughts and replacing them with positive thoughts is an outdated form of CBT. We can't think our way out of tinnitus. Changing your thinking is an important part of CBT, but programs that focus primarily on cognitive change are very out of date. Another common misconception is that CBT emphasizes breathing and relaxing to reduce anxiety. Well, breathing and relaxing is always a good thing for us, but studies show that as a method for addressing moderate to severe anxiety, like that associated with tinnitus distress, breathing and relaxing is a drop in the ocean. In fact, what we know as CBT is really a family of cognitive and behavioral therapies. You can learn more about this at our parent organization, the Association for Behavioral and Cognitive Therapies, or ABCT. The family of cognitive behavioral therapies is united under a common set of principles. They involve practical skills that can be learned and applied to address the problem. The therapy is efficient and short-term. The goal is to teach you these skills and get you started in applying them in your own life so that the therapist can eventually be faded out and you can handle this independently. Cognitive and behavioral therapies are science-based and evidence-based. Cognitive and behavioral therapies are designed to help people with the stuff of tinnitus distress. The concepts and strategies of CBT are flexibly adapted to address these different forms of suffering: health anxiety, generalized anxiety, panic attacks, phobias, post-traumatic stress disorder, obsessive compulsive disorder, depression, and of course, insomnia, all routinely come up in my CBT for tinnitus practice. Important members of the CBT for tinnitus family include acceptance and mindfulness-based programs, acceptance and commitment therapy, and mindfulness-based cognitive therapy. Both of these approaches have been shown through controlled research to significantly reduce tinnitus distress. As I've said, acceptance is a key concept for addressing problems that are intensely unwanted but cannot be directly changed, like tinnitus. And mindfulness is the primary acceptance tool used in CBT. So integrating acceptance and mindfulness, along with cognitive change and behavioral change, is critical to a best practice version of CBT for tinnitus. By best practice, by the way, I mean, and you can look this up, professional procedures that are accepted as being correct or most effective. So what would a best practice CBT for tinnitus look like? Well, using our ability to think and reason to help us cope with problems is an important part of CBT. Cognitive change strategies should be applied with the goal of developing an effective perspective, a way of understanding tinnitus that is reassuring and can be applied to guide and motivate the courageous work of rejoining your life. And with persistent problems like tinnitus, much of the cognitive change will be focused on developing greater tinnitus acceptance. Equally, if not more important, is changing your behavior. Some CBT therapists do still use breathing and relaxation techniques, but this is a very small part of treatment. True behavior change involves a commitment to the courageous work of gradually re-engaging in all the avoided areas of life and tapering off the behaviors meant to control and avoid tinnitus. And most thorough CBT programs today involve changing how we attend to and relate to the problem. In CBT, mindfulness is used to soften your response to tinnitus, soften your perception of tinnitus, and broaden your attention out to other sounds and sensations in your life. A best practice version of CBT for tinnitus will address the vulnerability factors that may be causing your distress and blocking habituation and recovery. Finally, anyone who has recovered from tinnitus distress knows the importance of habituation. So habituation, any good CBT for tinnitus program has got to promote habituation. And a quick test of whether your CBT therapist or program truly understands the problem is whether or not they emphasize habituation. If they don't, then in my professional and personal opinion, they just don't get it. So who's qualified to provide CBT for tinnitus? CBT is a mental health treatment intended to be provided by mental health professionals. This includes clinical psychologists, clinical social workers, licensed mental health counselors. But it's not just any mental health provider. You'll need a therapist who's trained and experienced in treating the kinds of emotional challenges that arise with tinnitus, such as anxiety, insomnia, and depression. Ideally, you'll find a mental health provider who is certified in cognitive and behavioral therapy. One certification agency is the Academy of Cognitive Therapy. Another is the American Board of Professional Psychology. This is where I received my CBT certification. This suffix after my PhD shows that I'm certified in cognitive and behavioral psychology by the American Board of Professional Psychology. If the therapist has tinnitus and has recovered from tinnitus distress, and I mean fully recovered, that's of course a plus. After all, you wouldn't want to take tennis lessons from someone who's never been on a tennis court. But remember, we've got this chasm between people suffering with tinnitus and qualified cognitive behavioral therapists. My psychology practice is based in New York City, but I do provide coaching and training to people struggling with tinnitus throughout the world. To date, I've coached and treated over 1,500 people with tinnitus. These sessions are offered over video conferencing platform and include all the concepts and strategies used in best practice CBT. I'm also developing an online course based on my CBT for Tinnitus program. The course will involve me guiding you through the process, teaching you the concepts and strategies you need to feel better and get your life back. How to escape the tinnitus trap and rejoin your life will be available this coming spring. Watch my website or sign up for updates. In conclusion, having tinnitus can be awful, but we can be grateful that of all the things that can happen to you, it's just tinnitus. Tinnitus is not dangerous, it's not physically painful, and there are good strategies available for making life a lot easier with tinnitus. We have a choice. We can keep banging our heads against the immovable wall of tinnitus or learn to navigate around it. As I said, I'm not just one of those tinnitus experts who talks the talk. I also walk the tinnitus walk. Over the first 6 months, I was completely hijacked by tinnitus. I was miserable all the time. I barely slept, could barely function. The only solution I could see was to bring down the volume. And unless that happened, I didn't believe I could ever be myself again, function again, be at peace again. But once I committed to acceptance and habituation, my life gradually improved. It took a couple of years and a lot of practice, patience, and persistence. My tinnitus hasn't changed at all, and I still have mild hyperacusis. But for the past 16 years, I've been living a full valued life. I notice my tinnitus about 0.1% of the day. The rest of the time, I don't even hear it. And when I do notice it, I don't care, and I forget about it again in seconds. It's truly a non-issue. My mission is to help as many people as possible achieve this same outcome. Here is a slide with some resources that you can check out. The ADAA.org has a tremendous amount of information about anxiety and depressive disorders and a list of therapists who are qualified to treat those aspects of tinnitus distress. ABCT.org, as I mentioned, is the parent organization for cognitive and behavioral therapies. My website, CBT for Tinnitus, you can access the first webinar that I did with ADAA on the website. And please visit my resources page, which has a tremendous amount of information and helpful links and even some free books that you can download on the topic. So again, thank you very much. It's been a pleasure to be here, and best wishes to everyone on their tinnitus habituation journey.